A major issue affecting the lifestyle and health of many Americans is the lack of adequate resources available to the full extent of our population. For my Health Science 101 final project, I have chosen to discuss the rising issue known as food deserts in America. Specifically, the issue is of a lack of widespread nutrition. One of the most essential keys to living a healthy lifestyle is balanced nutrition. For many Americans, however, their downfall comes from the lack of availability of products such as produce, lean protein, and other essential food group items. According to the Center for Disease Control, places that lack these adequate products are known as food deserts. Food deserts are defined as areas that lack access to affordable fruits, vegetables, whole grains, low-fat milk, and other foods that make up a wide range of a healthy diet. In recent reports, there are still populations of Americans that are living in food deserts due to their limited ability to the access of affordable foods or because of their proximity to realtors. Many urban and low-income communities are victims to food deserts. This is due to grocers not taking up businesses in areas such as these, leaving the population to rely on things such as gas stations, convenience stores, or other similar businesses as their source for grocery stores. What this problem does is place many Americans in a situation where their only option for meals are included packaged, processed, high-sugar, high-fat content snacks. Now, imagine your closest gas station. Now picture the array of candy bars, soda pop, chips, and other junk food items readily available to you. It is easy from here to also imagine the health risks that are posed when those become the basics of your everyday life. This is the fate of people trapped in food deserts. According to the Center for Disease Control, obesity-related diseases are some of the leading causes of death in America. Factors, such as improper nutrition, are among the top determinants of what increases the likelihood of developing obesity and obesity-related illnesses. Such illnesses can include, but are not limited to, heart disease, diabetes, and increases risk factors for stroke. The concept of food deserts is nothing new, and strikes even closer to home than most expect. In fact, certain rural areas of Vermont can be categorized as food deserts. In an article highlighted on the National Public Radio, governmental agencies across America are looking to reduce this issue of food deserts, and as such, have created programs to help citizens locate grocers. The Food Access Research Atlas, as implemented by the United States Department of Agriculture, is based on census-backed information and can be used for community planning or research. When using this atlas in reference to Vermont, it shows some of the more northern-lying regions of the state qualify in different stages and degrees of being food deserts. An example shows that in Franklin County, Vermont, there are over 100 residents that are without a vehicle and are over a half a mile from the nearest supermarket. Now imagine having to walk a half a mile through Vermont winters in order to get adequate nutrition. Additionally, this area also qualifies as having a significant amount of residents that are over 20 miles in general from the nearest supermarket. That is including those with transportation. However, you are now placing citizens in a period of time where they must travel over 20 miles each week in order to supply their families with food. Ways to combat the issues of food deserts can be addressed through a multitude of levels, as according to the socio-ecological model. For instance, on a more community-based level, bringing media attention to the issue of food deserts can raise awareness of the issue. By making more people aware of it and how detrimental this can be, people are more likely to seek reform for it. The issue, however, does not need to be addressed on such a large-scale manner only, and can be related to on an interpersonal level as well. Friends and family members can assist those trapped in food deserts by providing transportation to grocery stores or bringing those affected healthier choices than the ones currently available to them. Despite efforts made by the population in order to decrease the number of food deserts in America, as well as to raise efforts to support those trapped in food deserts, there are social determinants surrounding why food deserts still persist in America today. For instance, many may be ashamed of their inability to provide adequate nutrition for their families. Thus, they will not seek assistance when placed in these situations. This hinders not only them from fixing their situation, but as well as alerting the public to the issue in general at hand. Many low-income families have pride deterring them from asking for help when trapped in urban populations where convenience stores are the only forms of grocers available. Other social determinants include a general lack of education on the subject. Food deserts are not a controversial, popular topic nowadays, frequently discussed. Thus, it does not receive as much media attention as it deserves. What this concludes for people is they may not know that they are suffering and that they are trapped in something known as a food desert. Many may insist that this is how they have always lived and that this is perfectly normal. Some may have been raised that gas stations and convenience stores are acceptable forms of grocery stores, and thus they will not know that there is a problem. As well, children and family raised without fundamental education on proper nutrition will not know that the readily available snacks in convenience stores and grocery stores will not provide them with the proper ingredients and nutrition needed to have healthy lifestyles. According to The Tipping Point, written by Malcolm Gladwell, there are several fundamental reasons that you can educate people and insist them to change their behaviors. One major factor he discusses is known as the stickiness factor. The example he gives is early educational strategies for the stickiness factor used in educational programming such as Sesame Street. One of the successes of Sesame Street was the fact that it was able to teach children such basic lessons such as ABCs, basic math, and other social cues by how easily the information was absorbed by the audience. Presenting in a way that was both fun and memorable made it easier for the children to understand and recall the lessons. By using the stickiness factor when educating people on food deserts, one major portion they could go by is copying that Sesame Street model and using fun, educational programming, especially in school districts at a young age. By implementing the lessons early on in childhood, children will grow up knowing more about nutrition. Thus, they need to direct the stickiness factor at education for those that are uneducated. One example I have come up with is school districts creating nutritional challenges daily for their students. By having students collaborate on weekly lunch menus, and then the fun, tastiest, healthiest options are served the following week in the school district. This will get students to collaborate and think outside the box on meals that are both delicious and nutritious. Since they will be reinforced to use this model weekly, they will be able to have that stickiness factor, meaning it will stick with them through their lifestyle. As adults, they will be able to recognize then what makes up nutritious meals. Thus, they will be able to recognize that convenience stores and grocery stores are not acceptable places to purchase food. This concludes my presentation on food deserts. Thank you for watching. If you are looking for more information regarding food deserts, please check out the Center for Disease Control's website, as well as the National Public Radio website and the United States Department of Agriculture's website.